Shadow Health Minister Chris Bowen is speaking to the media here at Parliament House.
Mortality rate higher than you would hope for in a virus of around 4% as best we can judge at this early stage. And it's important that information be made available to people as to how to respond. I do think the federal government and the state governments are working well together across the board to ensure that the response is as good as it possibly can be. And of course, if people have concerns or need advice about what to do in relation to their daily movements, it's important to get that advice. And people, of course, can call Health Direct on 1800 022 222 for that advice. It's very understandable that people are concerned as school goes back to ensure that their children are safe. It's also necessary to take the necessary medical advice. And if anybody who has been to Wuhan or to China more broadly and feels symptoms, they should ring ahead to their GP, let them know they're coming in advance and be checked out as soon as possible. It's also, of course, important that people follow the advice more broadly. This is a serious outbreak, but Australia is well prepared for this incident, and the opposition will continue to provide whatever support is necessary on a bipartisan basis to the government as they deal with this, and to the Chief Medical Officer based on the best advice available at any particular time. This is fast moving. 2,800 cases now in China, most of them, or a substantial minority, in the Hubei province. 5 identified cases in Australia, but we are likely to see more. The second incident that I'll deal with, the second issue I'll deal with today is, of course, the ongoing saga of Bridget McKenzie. Things are pretty bad when you've got your own office engaging in whistleblowing against you. When it gets that bad, it's time to look yourself in the mirror and decide it's time to resign. And if you won't resign, it's time for the Prime Minister to sack you. This should not go on one day longer. Bridget McKenzie should not have survived a long weekend as Minister. She should certainly not be Minister by this time tomorrow. Look in the mirror and decide, and do the right thing and decide it's time to go. I understand the Prime Minister is holding a press conference on drought this afternoon. You would normally think the Minister for Agriculture would be at that press conference. Will Bridget McKenzie be at the press conference with the Prime Minister about a matter pertaining to her portfolio? Well, if she's at that press conference, she should say 2 words: I quit. That's what she should be telling the Australian people this afternoon. Happy to take any questions. Jennifer.
Is the government underplaying what is a global emergency here? We're obviously going to see more cases of coronavirus in Australia. Are we prepared?
Look, I don't mind giving the government criticism or giving the government advice, and if I do see things that I think the government can be doing better during this health emergency, then I will do so. But at this stage, I'm satisfied with all the I've received 2 briefings from the Chief Medical Officer, visited the incident room this morning, and I thank the government for making that available to me. And I'll also be responsible in saying that the government and the Chief Medical Officer, I think, have put in place the steps that they should have at this point. I've asked questions, for example, about the calls for thermo-imaging and temperature testing. All the medical advice is that would not work. And so the government should not put in place steps that will not work. I think it's incumbent on the government to provide as much information as possible to people, factual information, not to be alarmist, but to provide the factual updates to people and to allay people's concerns in a reasonable fashion as people return to school and work. And I would encourage them to continue to do so.
Is giving incoming passengers a pamphlet about coronavirus really enough, though, given it's now of pandemic potential?
Well, what they're doing is providing people with the information as to what steps they should take. The Chief Medical Officer also has powers under the Biosecurity Act to take further steps if somebody presents with symptoms on arrival, or indeed to take further steps if the situation escalates. But they are steps that would not be taken lightly. I do think providing people with that information is important. All the evidence and all the advice so far, the medical advice to us, and I'm sure to the government, is that people are not contagious until they are exhibiting symptoms. That's the best medical judgment at this point. Of course, if that changes, I'm sure the government would alert people to that fact. But I think providing that information, of course that's not all that's happening. With the one flight that did arrive from Wuhan, everybody was interviewed. I do think providing information more broadly is an appropriate step at this point.
Just on that note, on providing more information. The Australian Medical Association of WA have called for what a lot of other OECD countries have, which is like a national centre for disease control. They're a bit worried about different messaging and communication going state to state, especially WA being as far away as it is, and wanting to be kept in the centre and not on the periphery of this crisis. What's your response to that?
I think that could be examined in due course, but at this point, I'm aware that there are daily briefings between the Chief Medical Officer of Australia and his state and territory counterparts, full exchange of information. The states have obviously control of the hospital system and have powers under their own acts, as does the Chief Medical Officer under the Biosecurity Act and other federal acts. So the Federation can work if there is proper coordination and information sharing, and at this point I've seen no evidence that that's not the case.
We've still got over 100 Australian children trapped in Wuhan, and Maurice Payne hasn't been able to get them out at this point. The Americans are chartering their own plane, which I believe will arrive today back in the US. Will you or Penny Wong be seeking a briefing from Steve Butt on what the government's doing?
Yes, but I'm also, again, we don't want to overly politicise this situation. I don't underestimate the complexity when Australia does not have consulate representation in Wuhan and the city is quarantined. Of course, it is incumbent on the government to be protecting the interests of Australian citizens wherever they are and whatever they're facing. But I do recognise some of the complexities in this case. If we reach the conclusion that the government is not doing enough, then we'll be sure to say so. But I have not seen any evidence to that point, to that effect at the moment.